You're focusing us on uncertainties associated with the concentration response function, which is important, but I'd like to ask the question, what are the major sources of uncertainties in estimates of air pollution impacts on population health? And the concentration response function will have an impact, but largely we're measuring population health impacts within the observable response range. So any sensible, flexible model, as long as we don't go too far to different exposure levels, is probably going to be reasonably consistent. But let's think about something that was just discussed, the exposure data. What happens if we use exposures, ecologic exposures at the SMSA level, and what happens if we use them at the zip code level? Well, in LA, Mike's work showed there was a factor of 3. I can't think of a single concentration response function choice that would lead to that big of a difference. If I think of other sources of choice of analytic technique that could lead to large or small uncertainties, adjustment for individual covariates. We've done that extensively. Doesn't seem to be a big deal. I think the exposure assessment, to my mind, could be one of the dominant ones, and much more important than the choice of the concentration response. I had another one that was a big one too. It's slipping my mind. So
just actually, in terms of what EPA has been doing, the risk assessments that you've done now, I think a much better job of sort of setting out systematically the sources of uncertainty and trying to characterize them in some way. I mean, Zach or Mayor, could you make a comment?
Well, yeah. I mean, so I laid out up there, which doesn't have to be pulled back up, but the variety of functions and studies that we considered. But for instance, we actually had considered trying to run the more detailed sort of Jerrett-based effect estimates for LA with that kind of detailed profile, and just given time and methodological challenges, we couldn't adjust the surfaces down to look at alternate air quality standards, sort of the what if. It was just too complex for us given that time. But just to let folks know, even in our consideration of uncertainty, we haven't included those higher slopes that come when you address exposure misclassification or exposure error, which I think is a pretty important thing. And so we talk about that qualitatively. We say that the range of risk estimates we've looked at are essentially based on the primary national scale analyses, but we say that some of these more detailed looks are starting to suggest exposure profiles, that addressing those factors can even increase the slope more.
I thought of my other big ticket item, pardon me for jumping in, John. If you look at adjustment for co-pollutants, we talked about SO2 mitigating the PM2.5 effect when they're included in the same models, but not the other way around. So the choice of the exposure metric, the choice of the co-pollutants that go into the two models, I think would be, to my intuitive thinking, probably the two biggest sources of uncertainty that we would have to contend with.
So, I mean, and again, perhaps in the suggestion to ARB, and I think Roger and Dan and I once sat around for a number of years estimating the risks of radon. You remember that? And somewhere in this massive risk assessment, there was a huge table of every uncertainty. And you may remember that. And it was a useful exercise to develop such a table, because then you could begin to say, well, which ones are the most important? And it's probably a useful exercise here. I mean, you just listed some, Suresh has listed some of these, and it's hard to say either qualitatively or by expert judgment or quantitatively. It's not hard, but you can begin to make some estimates of which are most important, which are most critical, and line those up and begin to try and do, whether it's a sensitivity analysis as we saw from EPA or other methods, to try and understand what are the most critical uncertainties as you make decisions. And again, that's a useful exercise, because we've only potentially touched the surface of how long that list might be. Mike?
Thanks, John. Just a few comments that I think bear on what Suresh was commenting on, but also on the uncertainties that we face. The Women's Health Study and the teachers cohort both produce risks that are much larger than what we've seen. So if they were biologically implausible, we might say there's too much uncertainty there, we should throw out those risk estimates. But both those cohorts have very low levels of underlying absolute cardiovascular risk. So even small increases on a relatively low baseline are going to, in a relative sense, look quite large. So it's entirely plausible that those are reasonable estimates in a never-smoking cohort of women, or in a cohort of women where the baseline prevalence is 5% and there's no significant occupational exposure. So I think that that's one, looking and trying to understand the underlying population differences in their absolute versus relative risk is something that we need to think about a lot in doing the burden estimates. When we look at the effects in New York City, which have come up time and again, I want to emphasize that there were significant effects there for ischemic heart disease. There was a 20% increase, which if I scale it to the same exposure contrast as Los Angeles, it's actually a bigger increase. It's 1.56 relative risk, significant. So very significant. Now, here's another case where you have to understand the underlying exposure and population, because the underlying population that's subjected to the highest exposures is probably one of the healthiest populations in the world. You have Manhattan, Upper East Side, wealthy people, great access to health care, good diet, they're walking a lot, they're exercising, and they're getting the highest level of exposure that we can detect on what's arguably the most biologically plausible outcome. An effect, even in this healthy population, I think is quite remarkable, and it, to me, lends that it's even stronger evidence that air pollution is asserting an effect than a weaker one. So it's not a negative study at all, and it's probably one that, when we think about it in the context of this broader body of evidence that many people are talking about, it strengthens the base. Now, the scale of variability in the pollution, going back to what Dan has mentioned and what Suresh is mentioning, I think everybody views SO2 as a marker for near-source effects, and if we want to, have ARB and other government regulatory agencies do something, we need more measurements at fine-scale areas that represent high-gradient exposures near traffic and industry, where we're likely to see these bigger effects. We can't develop exposure models without the underlying data, and we can't go out and get the data every single time we do a health study. So that's something I think, when we look at reducing uncertainty, there's going to have to be a complete rethinking of the way that government monitors pollution. Now, just a couple of factual corrections. The reanalysis never tested a California-specific estimate. It tested a Southwest estimate, which includes at least 4 states. So there's no specific evidence from the reanalysis study on that. The respiratory effects that were shown to be, or thought to be biologically implausible, we have subsequently investigated those, published in the New England Journal of Medicine last year in our article investigating ozone. And when we put ozone in a model with PM, we nullify any of those negative risks because we show that the mixture that's associated with ozone is associated with mortality. So we talk about these uncertainties. We have to look at multi-pollutant models. And just one final point, we did test for proportionality hazard assumptions for key confounders like smoking and air pollution in the first reanalysis when there were only 9 years of follow-up and a lower likelihood of non-proportionality, and we found no evidence of it. So if you're thinking about not using the national level ACS study because you're concerned with that, we don't have any evidence that that's a problem yet.